Welcome. My name is Jagner Murillo Mena. The topic is about maintaining interviews fluids in actually in parties. Definition. Definition: the goal of maintaining interviews fluids is to preserve the extracellular volume while maintaining a normal electrolyte balance. This video
Normal saline is a commonly used isotonic intravenous crystalloid fluid. Although it was created to approximate the same osmolarity as human plasma, normal saline contains higher sodium and chloride concentrations than plasma, and its infusion can lead to hyperchloremic metabolic acidosis and kidney injury. Balanced crystalloid solutions, such as lactated ringers and plasma light A, have more physiologic electrolyte concentrations, and thus may have less negative impact on acutely ill patients. In the single-center pragmatic unblinded SALT-ED trial, investigators tested whether the composition of crystalloids affected outcomes in non-critically ill patients. Over 16 months, the trial enrolled 13,347 adults who received 500 milliliters or more of isotonic crystalloids in the emergency department.
application in medicine. Despite the almost ubiquitous need for interviews fluid in actually in parenting, there has been limited consequence of the most appropriate rate of administration and compensation in intravenous fluids. In practice, parenting with respect to maintaining fluid very well. This video
Recognizing acute kidney injury is important because when treated properly, it is eminently reversible and the patients will survive. If, however, it's not treated properly, then patients have a very much increased risk of death, even with minor levels of change in their kidney function. The toolkit can help because it identifies the causes of AKI, it defines those patients at risk, and it also gives a management algorithm to try and help doctors remember what needs to be done to optimize the treatment of patients suffering from acute kidney injury. Most cases of AKI are associated with sepsis or changes.
pro and cons. Interview fluids can be classified according to the concentration of sodium plus potassium in the fluid in bacterial agent ionic and hypotonic fluids. The discharge context of interview fluid has no effect on the tonicity, since they are destroyed in rapidly metabolized when it enters the bloodstream and so not produce hyperglycemia. This video
other option বলবেন যে there are some other option ESWL or some other resolution therapy but not effective. And if you have some silent stroke, you can keep it. তাই না? তো silent না হলে বাকি। তাহলে সব কথা বললেন যে গলস্টোন সম্পর্কে পৃথিবীতে এই আপনার ডায়াগনোসিসের জন্য এই করছে গলস্টোন সম্পর্কে পৃথিবীতে এই ধরনের চিকিৎসা এবং কমপ্লিকেশন। আপনি যদি গলস্টোনটা রেখে যান তাহলে এই কমপ্লিকেশন। আচ্ছা ওয়ার্ল্ডে চিকিৎসা আছে আপনার অপারেশন ওপেন করে করা যেতে পারে
in some applications in Ecuador. Over the past decade, many studies have evaluated the association between of the composition and quantity of the monetary fluid under the problem in the hypoglycemia. Hyponatremia response that also suggests rapid volume expansion with 0.9% swelling normalized.
You want me to start?
Yeah, that's good.
So Elaine's putting the giving set into the drip. But at the moment, that chamber is full of air.
That's closed.
What's closed?
This bit here.
Oh, that bit, yeah. Okay. So you've squeezed that to get some fluid in. Now, at the moment, there's air in here, isn't there?
Mm-hmm.
Do you want to give intravenous air to the patient?
No.
Not really. So we're going to run it through. And I think you can probably see the meniscus going down. There it goes. Yeah. It's going to go all the way through the tubing.
Conclusion. The recurrent reviews consider the physiology principle the glint of appropriate selection of the interval fluids. In the resultant literature evolution, the software of rating intervals of fluid with respect to the composition of the rate of administration.
In this video, we will learn about the technique of IV fluid preparation. All items needed for IV fluid preparation should be collected.
This finished. Thank you.